This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Yeah, this is I'm Gage. This is Chris. We are two of the chiefs with CR. Since we're going to be pressed on time, we might just want to push through. Chris will take you to the first half of the PowerPoint, and then I'll bring up through with the rest of it. Just to introduce ourselves, I'm a PG White 3, born and raised in West Virginia. Currently living in Charlotte, obviously. Lived in a couple places around Charlotte, so I kind of know the area pretty well. There you go. You fixed it.
Okay. All right.
Good job, man.
Yeah, I'm Chris. I'm a PGY4 and one of the chief residents. I'm from Maryland originally. Went to medical school at VCU in Richmond, and I've been in Charlotte, North Carolina for the last 3 years. So I know we are short on time, so we will get started. So we'll go over an overview of our program, a little bit about the curriculum, some academic highlights, and why y'all should consider Charlotte as your destination for residency. So our leadership, Dr. Crawford is our program director. She's wonderful. She took over, I think, about 3 years ago. And Dr. Shao is our assistant program director. He's been here forever. He did his residency here at CR, so he knows the program very well. Dr. Raj this year took over as our chair of the department. And on the next slide, Dr. Bachnick, you'll see in the upper right-hand corner, he was our previous chair, and he's moved on from that role, but he's still very, very involved with the program and with clinical matters within the department. I'm not going to read everybody on here, but we have a robust faculty in subspecialty areas of PM&R. So we get training from faculty who have very high training in their subspecialty field, but I think more importantly, they're great to work with. We have great relationships with our attendings. They definitely treat us with a lot of respect, and they're invested in our learning and our experience here. So we have a very diverse department, and like I said, we truly have experts in every facet of PM&R. So if you have an interest, there's probably a faculty member that also shares that interest and will be more than welcome to kind of take you under their wing. As far as our residents, we have 5 residents per year. 2 of the 5 spots are categorical, meaning that at least 2 residents will be guaranteed their intern year at Carolina's Medical Center, which is basically right next door to our rehab hospital. However, you can also apply outside of that categorical position for the intern year in and of itself. I think this year we have 4 out of 5 of our intern class here in Charlotte. And in my class as well, we had 4 out of 5, which was great, just kind of getting the lay of the land, not having to move twice. So it is possible to match outside of those 2 positions for the intern year here. And then we have a brain injury fellowship, cancer rehab fellowship, and a new spinal cord fellowship. You'll see we have brain injury and cancer rehab fellows this year. Dr. Viscusi just completed his residency here at Carolina's Rehab and now is the brain injury fellow. And next year we will be having our first spinal cord injury fellow, who I should also mention, by the way, our other chief resident, Dr. Kurtz, is not here because she just gave birth a couple days ago. So she is on maternity leave. Resident hometowns, I was taking a look at this and I'm not sure this is the most up to date. But needless to say, we get residents from all over the country. We definitely have some that come from the Southeast, but we have residents from the Midwest, from the Northeast, from California, from all over. So definitely welcome all of you to consider us and to apply. And there's no geographical preference for who we take in our residency. As far as our rotation sites, so we have specialty units for spinal cord injury, traumatic brain injury, stroke, cancer rehab, amputee care, pediatrics. So, our rotations are on these specialty units. So we're getting subspecialized training in basically everything you can think of, except the one thing that I do note that we don't have is burn rehab. So that is not something we have here, but that's pretty nuanced within PM&R, I think. 12 CARF accredited programs. We had the first CARF accredited program in cancer rehab in the world. We have a hospitalist who rounds on every patient, so you're not stuck doing all the medicine stuff. If you're someone who likes to do a little bit more of that, you can get involved with that, but you always have the backup or the co-guidance of a hospitalist. And this picture here is a mock-up of our new rehab hospital. However, since this photo was taken, the rehab hospital is open. So you'll see on the next slide, the real deal. So this is the David L. Conlin Rehab Center, opened January 2023. So it is up and running. It is beautiful. It's a great place to work. We also rotate at some of the ancillary rehab hospitals, mainly on the bottom right, Mount Holly. Some of us refer to it as Mount Hollywood. It's very popular. It's just like laid back. It's kind of a little bit more out of the city and into more of the country area. So the patients are very sweet and nice, and it's just a little bit of a slower pace than the downtown hustle and bustle. So everyone loves doing a few months out there as well. And then Northeast and Pineville, most of our experience there is in moonlighting, which we'll talk a little bit more about, basically doing evening admissions. And then the pediatric unit is in the Children's Hospital of our main hospitals, Carolinas Medical Center. And then, so this is just basically a list of what we already talked about, the inpatient sites. But the outpatient sites, we have MSKI, which is some of our musculoskeletal sports medicine outpatient clinics. We do a few rotations at the VA, which there's one in Charlotte and there's one north of Charlotte. So we rotate there, and that's outpatient as well. And then Ortho Carolina is a local orthopedics group in town. It's pretty renowned actually nationally, and we do most of our EMG with them. And then there are some other opportunities to get involved with them as well.
And I think from here, I'm going to take over. Chris, you're going to drive for me?
Yes.
Cool. And I think I only have a few minutes, so I'm going to cook through these pretty quick for you guys. Here's just the layover of our curriculum. As you can kind of notice, the bolds are the inpatient rotations. So the beginning of your rotations are usually pretty inpatient heavy, while the towards the end are usually pretty light and more outpatient and geared towards what you kind of want to do if you want to fellow versus do generalist physiatry. And next slide, please. Here's just a little overview about our didactic series and other kind of things that we offer. Our current didactic series is usually noon lectures from noon to 1. They can either be in person or via Teams. So if you're on the outpatient side, usually you just log in via Teams. And if you're inpatient, you're usually expected to be there. We attempted to do a half-day curriculum. It's still in the works. We might transition to a half-day eventually, but currently right now we're doing noon lectures. Resiliency curriculum. Can you go back for me, Chris? Resiliency curriculum. This is ran by a resident and one of the attendings. This is usually things we do like pickleball. Essentially, we just kind of set up times outside of work in order for us to have activities for resilience, and then they also incorporate this into our lecture series as well. And whenever we have different types of resiliency topics, we have a pretty robust DEI group, and I think they actually meet monthly. Our ultrasound curriculum really took a turnaround about 2 years ago. I think it's becoming a lot more robust as well recently. Usually for this, we'll watch a bunch of videos and then split up into groups with the whole residency together and practice on SPs, just looking at normal or abnormal anatomy. For the fluoro workshops, these are less often. The ultrasound curriculum is once a month. For the fluoro workshops, I think it's about once a quarter. And we actually utilize cadavers, and the MSKI attendings will join us and go through the cadavers with us, and a bunch of different research opportunities if you are kind of interested in that. Here's a scholarship that we offer for fourth year away rotations. It could be up to $2,000. Lorena is our medical student liaison. So this is her email if you guys ever need it, or to reach out to her. And this is through the same process as you typically would if you wanted to do an away audition rotation with us. Community involvement. We do a good bit of this. This top picture right here is us at our most recent MedFest, where we did a ton of physical exams for the Special Olympics kids. A bunch of local kids will come to one of the larger high school gyms, and we crank out a bunch of physical exams for them. It's really fun. A bunch of volunteer events that are kind of random. I'm not going to go through a bunch of them. The liver rounds, one of our residents kind of plans once a month, I think it is, outings with the residents and the faculty, usually at like a local restaurant or brewery, where you can kind of just relax once a month and get to know your attendings a little bit better. The ASAP program is pretty big. It's not only just CR, or Carolinas Rehab, but also involving other entities within Charlotte. And it's an adaptive sports program. And they actually take a lot of the inpatients to do this. So you can, whenever you do your therapy month, which was on one of the previous slides, you can actually go and play tennis with some of the spinal cord injury patients. It's a really rewarding experience. Here's some other programs that we offer. AHEC is mostly just presenting. I think Chris did it too, mostly presenting to high school students about different types of medical opportunities to them in their future. Cycle to the Sea, something I probably couldn't do, but it's a program from the Mid-Atlantic, and I guess they cycle to the sea. And then one of our attendings, Dr. Mitchell, heads this Greenway cleanup, which the Greenway is a running system essentially through Charlotte, usually along the creeks. Here's us playing pickleball. I guess that's you guys at the Whitewater Center last year. Yep. That's them again. This is just some of the examples of our outings that we do for like every half year that we have to do. I think this was one, and then this was them last year.
Yeah, these are our wellness retreats twice a year.
Yeah. And this is an example of liver rounds, I guess, in the bottom corner. And that one probably is too. So call schedule, this is some of the important stuff. So you do essentially a little bit more call when you're PGY2 and a lot less call when you're PGY4. But that's usually split with moonlights. So essentially the after hour works kind of remains the same the entire time you're here. It's just you're doing less call as you progress through the year and more moonlighting opportunities, which we can talk about. But as you can read here, about 2 to 3 weeknights per month as a 2, and then every 5th weekend, essentially, as a PGY2, you're covering the hospital. PGY3, a little bit less than PGY4, only 4 nights, no weekends, and you split a weekend with a PGY2 whenever they start to kind of coach them along their first weekend call. Whenever you do this, you're covering 4 rehab locations. You're not rounding on all those people, obviously. You usually just split all of the patients at the main rehab site, Carolinas Rehab, the main site. And then for the weekend, so the after hours time, you're covering all the rehab locations, which is the normal expectation on a regular night call as well. But every time you're on call, you get a half day off the next day. So once noon hits or after lecture, so 1 o'clock, you're free for the day. No more clinical duties. So why us? Pretty much talked about the first point pretty extensively. Our moonlighting opportunities are admissions after 5 p.m. You can get scheduled to do moonlighting, but that doesn't mean you have to do them as long as somebody's doing them. Essentially, a lot of people who are a little bit more financially driven, since it's a moonlighting opportunity, they do more. And then there's folks that usually don't care to do them. The opportunity is always there. The retirement match here is incredible. I think it's up to 6% matched equally. I don't really utilize this. The parking here is pristine. We just park right next to the hospital. It's 30-second walk. You get a ton of free food. It's usually based off of how much inpatient you're doing, and you're paid quarterly. It's pretty hard to reach your max money for meals, and you can get things like Caribou Coffee, which is like Starbucks. You can get Starbucks as well. And the city of Charlotte is awesome, which I think we have some examples of things to do in Charlotte in the previous slides. Yep, pretty large city. The metro area is a lot larger than this. I think it's like 1.5 million. Here's just a bunch of facts for you if you kind of want to read through. We are one of the top employers. Atrium is very integrated into the community of the city. And here's just some other opportunities for maybe significant others if you're bringing somebody with you. And all the fun outdoor things. So the greenways I talked about a little bit earlier, that's essentially a trail system that runs through the city. It's very extensive, 52 plus miles. If you're a runner, it's very ideal and very safe. The Whitewater Center, which we showed pictures of earlier, it's rafting essentially. They also do free concerts every Thursday in the summer. And here's a big long list of other things that is offered in or around the city. And some more pictures of us doing fun things. Top right is Halloween party, and then the rest of them is just hanging out. But we're welcome for any questions.
We have about 3 minutes.
Okay, that's good timing. Let's see.
Thing in the chat. Do you get to work regularly with any medical students? Yes. So we are associated with Wake Forest School of Medicine, so we get plenty of med students from Wake Forest, but then we get tons of away rotation residents. And just to clarify on the point earlier about the scholarship, that is for underrepresented groups in medicine. So that would be the groups that would qualify for the scholarship. But obviously, we welcome everybody to apply for away rotations. Here we welcome medical students. We love having them. We almost always have medical students, I feel like. And then, do you have opportunities for SciLed coverage? Yes, we do. And it's just now being integrated as a requirement as part of our sports medicine rotation, but there are opportunities. And there's even like other opportunities Gage talked about with Special Olympics doing the physicals, but we also have a program that like does sports physicals for like Charlotte metro area kids, and they do that in the Panthers Stadium, I think, which is pretty cool. But yes, there are opportunities for sideline coverage for sports. Yeah, and if there's no other questions, please keep them coming in the chat. But just to reemphasize, I think those high points that Gage hit on of like why our program, it's really, really true. So I think the home call with post call afternoon, I remember when I was applying, I didn't really see that anywhere. I think that's really great. The moonlighting, if you're looking to make a little extra money, can be significant, and it's really not that bad. Like usually 2 shifts a month is what you're scheduled for, and you can make some good supplemental money. The 401k is 4%. You put in 6 and you get a 4% match, and you get a lot of like payment, employer contribution for HSAs, things like that. What is the split in fellowships or general? Let's see. This year it'll be 2
and 3.
2 and 3. I think last year was 2 and 3. So 2 fellowship, 3 general. But every year it kind of varies. Yeah. And like the matches for like some of the more competitive ones have been really good. We have one guy just went to UPMC for pain, and then brain injury here at Carolina's Rehab, were the last year. And then the year before that, it was like UPenn, Emory, and Wake Forest for interventional or pain medicine.
Anybody that wants the fellow gets in pretty much to where they want to go, at least in the most recent past. Any other questions? Pelvic floor rehab, I'm not too sure about that.
Where do you see that?
Exposure to pelvic floor rehab. Off the top of my head, I'm not all too sure.
I have not encountered that. Yeah. However, like that just brings up the point that like if you really like something, the Atrium system is so large that there's probably someone you can work with. Like we work really closely with urologists. We have urologists in our rehab department that could probably connect you there or the therapist. And it's very encouraged to go out and find what you're interested in. We had a resident who was interested in international medicine or global health, and he did a whole month in Nepal for his elective rotation. So if you want to do it, there's resources. We have a giant system here that has a little bit of everything, and you're definitely encouraged to go seek things that you're interested in. So the signaling, this is new because when I did this, when I applied, there was no signaling, but we just talked about this in a recent meeting that because of the increase, I guess from 4 to 8 signals, I think it is, or something like that. If you truly are interested in our program, we would encourage you to signal. That just kind of the nature of the beast with the number of applications we get. That was the message that I got from our program director. But as far as regional, like if you're from the area, I don't think that necessarily matters. But if you want to express your interest in our program, it is probably wise to do the signaling. Yeah.
We take people from everywhere.
Yeah.
I think that is it for time for us.
Awesome. Well, thank you.
Thanks, everybody.